Welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Bon après-midi, tout le monde est bien.
Good afternoon, everyone, and welcome to this COVID-19 update. Speaking on behalf of the province, we have today Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health.
Good afternoon. Bon après-midi à toutes et à tous.
We have lost another New Brunswicker to COVID-19. An individual aged 50 to 59 in Zone 1 has died from the effects of this virus. We have now lost 120 New Brunswickers to this pandemic.
We have lost another New Brunswicker to COVID-19. An individual aged 50 to 59 in Zone 1, the Moncton region, has died from the effects of the virus. We have now lost 120 New Brunswickers to this pandemic. And this never gets easier, nor should it. Each New Brunswicker we have lost to this pandemic diminishes all of us. It is now 4 weeks since circuit breaker measures were introduced to slow the spread of COVID-19 in New Brunswick. And through these measures and the efforts of all New Brunswickers, we are making progress and rolling back the fourth wave of this pandemic. Progress has emerged slowly and at different rates across our province.
Some areas have done very well in reducing the spread of the virus, while outbreaks persist elsewhere. But by almost every measure, we are seeing improvement in our situation. Our daily case numbers have fallen significantly from where they were a month ago.
And the number of active cases is now barely half of what it was then. There are fewer New Brunswickers in the hospital due to COVID-19, and intensive care admissions have also declined. This has given us the confidence to recommend the reduction of some restrictions in some areas of New Brunswick, and Minister Shepherd will speak to this shortly. There are, however, areas where we remain concerned about the spread of the virus. Public Health remains concerned about the spread of COVID-19 in Zone 1, which is Moncton and Southeast New Brunswick, and in Zone 2, which is St. John and Kings County. We are also keeping a close eye on the growing number of cases in the Miramichi zone. We are also seeing many cases being spread within households. Up to half of our new cases are occurring this way. This means it is more urgent than ever that everyone limit their contacts outside of their immediate households. Aujourd'hui, Santé publique a confirmé 30.
Today, Public Health has confirmed 39 new cases of COVID-19 in New Brunswick. We have seen new case number levels of after peaking at more than 100 per day in early October. This week, the number of active cases fell below 500 for the first time in more than 6 weeks. As of today, there are 464 New Brunswickers who have COVID-19. There are now 18 New Brunswickers in hospital due to COVID-19, 12 of whom are under intensive care at this time.
Public Health has confirmed 39 new cases of COVID-19 in New Brunswick. We have seen new case numbers level off after peaking at more than 100 per day in early October. This week, the number of active cases fell below 500 for the first time in more than 6 weeks. With 32 recoveries reported today, there are now 464 New Brunswickers who have COVID-19. There are 18 New Brunswickers in the hospital due to COVID-19, 12 of whom are under intensive care at this time. We are making progress because of the choices that each of you have made to follow public health guidance and advice. And really, when it comes down to it, we do have information from our surveys that show that the majority of the population of New Brunswick is committed to following public health directions. By reducing close contacts with people outside of your household, by regularly washing your hands, by staying home when you don't feel well, by getting fully vaccinated against COVID-19, these are actions that have helped us to turn the tide against the fourth wave. But we must have continued vigilance across the province to prevent a resurgence of the virus. This is particularly important in the Moncton and St. John areas where case numbers and hospitalizations remain elevated. And I would caution that anybody who does receive public health guidance about their self-isolation, follow it very, very specifically. I'm going to show you 2 slides that show the ongoing situation in southern New Brunswick. So the first image is a graph of the daily new cases in Zone 1, the Moncton area, which has been under circuit breaker restrictions since October 8th. The bars on this graph show the number of new cases each day, with the black line representing the rolling 7-day average of new cases. And as you can see, the circuit breaker measures are having a positive effect, with cases declining over the last month. But they are still higher than elsewhere in the province. So the second graph shows daily new cases in the St. John area, where circuit breaker rules were put in place last week. The growth in new cases appears to be slowing, but as the COVID-19 virus has an incubation period of up to 2 weeks, more time will be needed to determine if this trend will hold. Santé publique surveille également de
Public Health is also keeping a close watch on Zone 7, which is the Miramichi area. This area has seen a spike in cases over the past week due to cases reported at a community shelter. While a circuit breaker is not required today, we ask residents to be vigilant in that region. We will continue to observe the track of the virus and will take action as required.
Health is also keeping a close watch on Zone 7, which is the Miramichi area. This area has seen an increase in positive cases over the past week, and the majority of these appear to be connected to 2 separate clusters of infections. We are making an aggressive effort to contain these outbreaks at their sources. We will continue to monitor the track of the virus and are ready to modify our approach if required. While a circuit breaker is not required at this time, I ask that everyone be vigilant and follow public health guidance and advice. This is likely to be our pattern for the foreseeable future. When cases rise, restrictions will be put in place to slow the growth of outbreaks. When cases and hospitalizations decline, restrictions may be loosened. If everyone continues to follow public health guidance and our vaccination rate continues to rise, I am confident that we will be able to further reduce the impact of the fourth wave on our province. Le jour du souvenir.
Next week is Remembrance Day, and again, this year we must observe this solemn occasion in a way that protects everyone's health. I want to apologize to Legion members who were sent guidance in error yesterday. Remembrance Day ceremonies are important and can take place throughout the province, indoor and outdoors, including circuit breaker areas, as long as public health guidance is followed.
And again this year, we must observe this solemn occasion in a way that protects everyone's health. I want to apologize to the members of the Royal Canadian Legion who were sent incorrect guidance in error yesterday. Remembrance Day ceremonies are important and can take place throughout the province, indoor and outdoors, including circuit breaker areas, as long as public health guidance is followed. It is important to remember those who made the ultimate sacrifice for our country in wartime. For those unable to attend in person, some communities may offer alternate means of observance, such as drive-by events and virtual remembrances. We have indeed come a long way in reducing the impact of the fourth wave, but we still have some distance to go. The actions you are taking and the choices you are making are working. Please keep doing what you are doing. We can get through this fourth wave, as we did the previous three, but we must do it together. Thank you very much.
Good afternoon. Bonjour. I was sorry to hear today that we have lost another person as a result of COVID-19. Our thoughts are with this person's family and friends who are grieving their loss. The fourth wave of the pandemic has been hard on our province, and it has been further complicated by the strike action underway. All hospitals in the Horizon Health Network are experiencing delays in screening patients at the main entrances. To date, 7,991 appointments, including appointments for surgeries and procedures, have had to be cancelled or postponed by Horizon Health Network, and 188 surgeries have been cancelled. While Horizon's community health centres and clinics and addiction and mental health services are operating, they are doing so with limited services. Delays are also occurring in accessing Vitalité's hospitals and points of service. To date, 661 appointments with outpatient care services, 90 surgeries, and 18 medical imaging appointments have been cancelled by Vitalité Health Network. Laundry services have been greatly reduced at all hospitals. As well, the strike has had a direct impact on our pandemic response. Some regional health authorities, vaccination clinics, and COVID-19 screening at assessment centres have had to be cancelled or rescheduled. At this time, Regional Health Authority vaccination clinics are only accepting people with scheduled appointments, and they're not able to accommodate walk-in appointments. If you are unable to get into a Regional Health Authority clinic, I encourage you to contact a participating pharmacy, as vaccination still remains critical in helping to keep all of us safe. Other COVID-19 services that have been affected include the cancellation of some Horizon Health Network's mobile rapid screening kit pickup locations and some rapid screening kit pickup sites within the Vitalité Health Network. An already challenging time has gotten more challenging, but our health partners continue to work with public health and are doing their very best to keep Nouveau-Brunswickers safe. I want to thank everyone who has gone above and beyond to ensure testing and vaccination services are available, including those working in pharmacies across our province. Working together, we will get through this. The last few weeks have shown us what is possible when we work together for the greater good. After circuit breaker measures were put into effect, many New Brunswickers living in those areas took the extra precautions necessary to keep one another safe. Since that time, we have seen an overall decrease in new cases, active cases, and hospitalizations. However, as Dr. Russell said, some areas remain of concern, including much of Zone 1, the Moncton region, and a large section of Zone 2, the St. John region. The overall case activity in these areas remain high, and positivity rates are above the provincial average. Household transmission is responsible for about half of our new cases. That is why, on the advice of Public Health, at COVID Cabinet Committee, all opposition leaders and Cabinet agreed to extend the circuit breaker into certain areas of Zone 1 and Zone 2 for at least another 7 days. I know this isn't the news that residents in these areas hope to hear, but it is important to ensure we are on the right path before easing those restrictions. I am encouraged to see overall case activity has decreased significantly in Zone 3, the Fredericton region, Zone 4, the Edmundston region, and Zone 5, the Campbellton region. Because the positivity rate is below the provincial average and hospitalizations are lower, COVID Cabinet Committee and the Cabinet agreed to lift circuit breaker restrictions in these areas effective at 6 p.m. tomorrow. I want to thank everyone who's worked so hard to make this happen. While you should be proud of what you achieved, it is important to remember the Delta variant is with us. As Dr. Russell said, we are seeing an increase in cases in Zone 7, the Miramichi region. Public health will continue to monitor the situation, and further action will be taken if required. No matter where you live in the province, I ask that you continue to do everything within your power to keep yourself, your loved ones, and your community safe, including getting vaccinated and following the measures currently in place. As of today, 85.4% of New Brunswickers are fully vaccinated, and 92.8% have received one dose of the COVID-19 vaccine. While the evidence is clear that vaccination is our best protection against serious illness and death, vaccination coupled with other public health measures is our best chance for success when it comes to the challenges we are facing due to the Delta variant. As you may be aware, the United States is opening its borders with Canada to fully vaccinated travelers on Monday, November the 8th. This is a day that many New Brunswickers have looked forward to. Our province shares more than a geographical border with Maine, but we also share families and communities. It is important to remember, however, that everyone entering New Brunswick from Maine or from any other state or country is subject to requirements under federal and provincial guidelines. Everyone entering New Brunswick must pre-register their travel online at the gnb.ca website. This includes New Brunswickers re-entering the province even after a brief trip. Travelers must also comply with federal requirements. More information is available online through the Government of Canada's COVID-19 travel, testing, and border pages at the canada.ca website. Learning to live with COVID-19 isn't always easy, but there are sure to be more bumps along the way. But it is something we must do if we want to continue to move forward. And the best way is for us to do it together. Because of your collective efforts, we are making progress, and with your help, we will continue to do so. Thank you. Merci.
Merci, Madame Ministre et Dr. Russell. Thank you, Minister. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions.
We will now proceed with questions from the media. You can ask your question in the language of your choice, and each reporter will have one question and a follow-up question.
Each reporter will have one question and one quick follow-up. You have the right to pose your question in the official language of your choice. Vicky Hogarth, CHCO.
Thank you, Bruce. Dr. Russell, Minister Shepherd, since the strike started, approximately how many people are we able to test today for COVID-19? And are you concerned that we might be missing a significant number of positive cases by not testing at our full capacity right now?
Hi, Vicki. So we have done, as of yesterday, we had done 727 tests yesterday alone, and 300 of those were PCR and 427 were gene experts, so which are also PCR. So as of right now, we are doing our best to prioritize, and that's really our focus during the strike action and this current surge. So that's how we're managing right now, and we continue to look at our positivity rates in all the zones to make sure that we're not missing anybody. Is it possible that we could miss someone? Hopefully not. I know people do have questions about point-of-care tests that they may have tested positive on, and having a follow-up PCR test is a challenge, but those people have been instructed to self-isolate, and so if everybody's following public health advice right now, then hopefully we will definitely minimize any of those risks of missing anybody.
You know, our point-of-care testing kits that have been distributed in various neighborhoods throughout the province, we have distributed 92,928 kits. So we've deployed more than 2.7 tests. And now the community is a partner in monitoring for signs of COVID-19 with themselves. And when they receive a presumptive positive, they call public health, and public health tells them what to do. This will kind of be a part of the evolution to living with COVID.
Both. Ms. Hogarth, do you have a follow-up?
Yes, are you worried about the long-term and overall effects the strike could have on the health of New Brunswickers who are missing appointments and even surgeries right now?
Well, I have to say that every single challenge we have in healthcare worries me for the health outcomes of the people of New Brunswick. So everyone has just been tremendous in doing everything they can to minimize those impacts, and we'll do everything we can to get back at full steam.
Thank you. Michael Tutton, Canadian Press. We'll now move on to Laurel Lyle, with CTV.
Thank you, Bruce. The Premier earlier today was sharing some concerns that he had about the number of unvaccinated healthcare workers in the province. I'm wondering if you have either, I'm not sure if this would be probably for the minister, but if you either have that percentage of healthcare workers who are unvaccinated or those who are fully vaccinated at this point.
So the numbers I have with me are that with the RHAs and Medivy, we have approximately 10.5% which are unvaccinated, and that equates to, I believe, about 1,968 individuals. I'm concerned. Of course I'm concerned. This is, we know that vaccination is our very best tool in the toolbox to prevent the not only the transmission of COVID, but the receiving it. So we would like to see and continue to push for everyone to get vaccinated.
Ms. Lyle, do you have a follow-up?
I do. Thank you. I wanted to shift gears here just quickly for a moment and ask you, Minister, about the cyber attack in Newfoundland and Labrador. I'm wondering how concerned you are about the possibility of something like that happening in New Brunswick, and if there are any changes or any conversations happening now to prevent that possibility.
From what I understand, cyber attacks are something that every single corporation and indeed health authorities across the country need to be worried about. These are very dangerous cyber attacks causing huge interruptions of healthcare information that's needed for the provision of providing good health care. And absolutely, Horizon and Vitalite both. We've had these conversations long before today. And it's no surprise when it happens in any community. And so we, both authorities have been taking measures to ensure that we have the best protection possible, and they will continue to do that. I will say the IT sector is always evolving, and things change very quickly. So it's incumbent upon us to make sure that we're making those investments and keeping on top of it.
Thank you both. Miriam LaFontaine with CBC.
Thank you. Yes, I wanted to ask regarding the outdoor Remembrance Day events that are allowed to proceed in circuit breaker areas. We were told previously that outdoor gatherings in these areas are supposed to be limited to single households. So I was trying to understand, is this a violation of the order?
No, I think I can help you with that. Even all through COVID and at times when we've had circuit breakers or, red levels, orange levels, etc., we have had public health guidance on special occasions with regards to outdoor gatherings. Last year, it was a very limited gatherings. Halloween, we made I hate to use the word exceptions, but we had public health guidelines to allow Halloween to go forward. The posting yesterday was regrettable, and it was done utilizing circuit breaker guidelines before Remembrance Day guidelines were put out, which have been put out now, and I believe are on the website. So it's not breaking the rules. What we're asking people to do when they go to an outside gathering is to remain in their close family bubbles, 6 feet, 2 meters apart from other attending families or bubbles or individuals. And preferably, we'd like you, even though it's outdoors, to wear a mask and just always remain responsible.
Ms. LaFontaine, do you have a follow-up?
Yes, I was hoping to get an update. We were told previously that healthcare reforms were expected to be announced at the end of October. I think this is for Ms. Shepherd.
Thank you. And I spoke to it yesterday, actually. So it was, we did, the health plan is completed. It's been translated. We're waiting on a couple of more details to get confirmed before we go public with the full document. I'm excited and anxious to put it out. We have focused on 5 areas for strategies in our provinces, which begin with primary care access, surgical access, a connected system, which means a network of excellence, promoting our mental health and addictions and mental health plan along with this, and the care of seniors for long-term care and to keep seniors in their homes. So we're very excited that this is a patient-centered plan, and the document has been written for the public. So I'm going to be excited to get it out. It is within the coming days, and I'll look forward to bringing that to you.
Thank you both. Bobby Jean McKinnon with CBC.
Yes, hello, can you hear me okay?
If you could, yes, a little louder would be just great. Thank you.
Okay, thank you. Under the emergency order, people who get a positive rapid test are mandated to immediately schedule a PCR test and are supposed to isolate until they do, but they're not among the 4 prioritized groups. So what is the backlog of tests and how many people are waiting for appointments?
I don't know if I have those numbers here, but what I can say is that public health, and Dr. Russell may want to comment on this as well, the most important thing is that individuals take the presumptive positive seriously. Call public health, call to request a PCR test. Public health will ask a number of questions and will offer advice and direction on where to go if the PCR test is necessary. So it is being managed with some of the limited resources we have right now, and I'll see if Dr. Russell needs to add anything.
I think you got it all.
Yeah.
Oh, there we go. Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Once the testing centers reopen, is there a plan to ramp up capacity to address the backlog?
We, as I just spoke earlier, we have distributed 92,928 kits into our public system, and of course we want to keep PCR testing, going to a maximum capacity if necessary. But what we're now going to be, I think, what the public can expect is over again the next period of time as we come out of our 4th wave. We'll be looking for the public to be partners in their healthcare and their healthcare vigilance with regards to COVID-19, utilizing the point-of-care testing kits that they have, and then following up with public health as an extra measure. So yesterday we tested 727 people. And I can also add that from Sunday, I think it's October 23rd, to the following Tuesday, and then this past Sunday to this Tuesday, we were at about 80% testing capacity, and so we know that some of those numbers have in the last couple of days have declined as well. But again, the point of care tests are in community, and they can help us with this.
Thank you both. Justin Dupuis, l'Acadie Nouvelle.
Hi, I would like to know if you are thinking about giving up the vaccine mandate for all the healthcare workers. I know that Quebec did it, so are you planning on not having this vaccine mandate for healthcare workers?
See, I appreciate the question. We are aware of Quebec and Ontario's decisions yesterday. We'll be looking into our own mandate, looking into the fact that we still have 1,900 plus RHA and Medivy employees who are not vaccinated. It is preferable, and we right now have a mandatory order in place. Our deadline is November the 19th, and I'm sure that we will be following this and looking into how we manage going forward after the 19th.
Do you have a follow-up question? Do you have a follow-up question? I'm curious to know when the decision will be made because the date is coming up soon. So do you know when the decision will be made?
Not today. We generally have COVID Cabinet Committee and Cabinet every week, and I'm sure that the decision will come from there.
Merci. Adam Harris with Brunswick News.
Thanks, Bruce. I just wanted to get to the bottom of the Remembrance Day changing guidance. The Department of Health defended yesterday evening the original guidance, suggesting it was in line with circuit breaker restrictions. So to clarify, was this a clerical error in sending out the original guidance, or was there further discussion last night or this morning to change the rules to allow gatherings?
Thank you, Adam. I didn't know about this until this morning, and so I immediately, checked into it. Let me just say that it appeared that some phone calls were received asking about the inquiries, and someone took the circuit breaker measures and utilized them as their reference. So you have to appreciate that with everything that's going on in our healthcare system right now, people are tired, and it's easy to try to get things fixed right away. So we knew that because of Halloween and the accommodations we've made there, other accommodations we've made in the past, that Remembrance Day is an extremely important day of observance for many New Brunswickers, including myself. You can be sure that I'll be at a cenotaph on November 11th. And so we quickly went to get those, to get the input and to ensure that the public had a document, it's now online, that they could prepare for their services for the November 11th.
Mr. Harris, do you have a follow-up?
Yes, please, Bruce. Thanks. I just want to piggyback on Bobby Jean's question. Can you confirm that there is a backlog in the number of tests, I guess, to be reviewed? And is there a risk at delaying the results of those tests to public health?
Hi, Adam. So in order to mitigate those risks, what we've done over the course of the last several days is we identified 4 priority groups that are now being considered for PCR testing, again, to address the fact that we have to really be judicious about our capacity and making sure that the right people are getting tested. So the 4 priority groups include people who are working and living in vulnerable settings, such as a hospital, long-term care facility, correctional center, First Nations community or shelter, those prioritized by a medical officer of health, anyone who is symptomatic with priority given to those who are unvaccinated, and testing required for travel, although there isn't a guarantee of the 72-hour turnaround time for those test results. And again, our message to the public is to expect delays at this point in time if you fall outside of those identified priority groups. And if you are asymptomatic, you are still able to pick up a test kit at one of our identified community sites.
Thank you. On va maintenant procéder avec Sophie des Hôtels avec Radio-Canada.
We will now proceed with the Sophie des Hôtels with Radio Canada. My question is for Dr. Russell. My question is in French. Please answer in French. I know that you have answered in English. So you said that some services were reduced, including some COVID services because of the strike. So how do you make sure that you are not missing out on cases? So you want me to reassure you on the way we are mitigating risks, so to make sure that we are not missing cases. So as you know, we have an emergency operations center for health. This is a full-time center, 24/7. With the strike, the same people work on the same committees to make sure that every part of the system that needs attention, that needs changes to improve the situation, is in place. So everybody in the network have communicated with the specialists, the partners in the labs, in our communities, about all the situations. So I can tell you that we cannot cover the risk 100%, but we are doing everything we can to make sure that all the risks that we can manage, we are managing them right now. So do you have a follow-up? Yes. Can you explain to me more precisely what the backlog is with the COVID tests? I do not have a number. I know that every day we have as many PCR tests as we can, and we cannot really have 100% of the tests we want to conduct. So we have 4 priority groups: the people working and living in a vulnerable setting like a hospital, nursing home, correctional centers, First Nations, communities, all those that are prioritized by a medical officer of health, and people with symptoms, especially those who are unvaccinated and those who need a test to travel. We will conduct the test, but there is no guarantee that we will get the results within 72 hours. So we are telling the public that right now it is normal to see delays, especially if you are not part of those 4 priority groups. If you don't have symptoms, it is still possible to pick up POCT tests in the community. Thank you very much, Ms. Deshôtels.
Can you hear me okay?
A little louder, but yes.
Okay.
Thank you.
Thanks. This question is for Minister Shepherd. When Megan Mitten called for an investigation into the response to the outbreak at the Drew Nursing Home, you said at that time that the government was very transparent. But I've requested a basic timeline of that response just over 2 weeks ago now and have yet to get that information. So I guess my question is, why is the Department of Health not releasing some of that basic information about what happened at the Drew Nursing Home?
Well, I'm very sure that information will be relayed to you as soon as possible. RTIs have a 30-day timeline. We have Most likely, I can tell you definitely double digits of requests into the Department of Health on any given day for information, and it just takes a while to process. So there's no indication to me that that you wouldn't receive that information, and we would be we are extremely transparent in that. So it's a matter of someone confirming that information and getting it to you and putting it through the proper process.
Ms. Butler, do you have a follow-up?
I had a question for Dr. Russell, just about community transmission. Now, you had mentioned before that we do have community spread in the province, but there's been no information about where it's happening. And I know the case origin stats on the dashboard were recently updated, and the number of community spread cases was increased there, but there's still over 1,000 cases that are listed under investigation. So I guess I'm just wondering, can you give information to, help warn people about where community spread is happening? Yeah.
So with respect to community spread, obviously, with the number of current active cases, there would be a percentage of those that would be community transmission. And technically, if we're not catching all the cases, we would then see that translate into hospitalizations eventually. The transmission pattern that we're seeing for the most part, as I mentioned during my comments, is in households and large gatherings, and particularly in Zone 2. So those are the risks that we're really concerned about at this moment in time. And obviously, if everybody's doing their best to follow public health guidance, then obviously that's minimizing those risks as well. And then just to come back to two reporters' questions around whether or not there's a backlog. We do actually see a backlog, but they don't include those people that are in those 4 priority test groups. So in terms of the risks, if somebody wants a test and they have asked for a test and they aren't part of that priority group, then again, they won't be done at the same rate that the folks in the priority testing groups will be tested. And again, that's based on risk.
Thank you. Travis Fortnum with Global TV.
Hey there. Actually, on that note, Dr. Russell, and I apologize because I did hear you address travel as a priority group. Minister Shepherd had spoken about the main border opening up again, and obviously folks are excited to get across there. And she alluded to some of the federal guidelines for coming back. And as you mentioned, to come back into Canada, you need a negative PCR test result. If you're there for under 72 hours, it can be a test that you took here before you went over there. Wondering what advice you might have around that, considering some of what we're hearing around backlogs of getting results.
Yeah, as I mentioned before, we are telling people to expect delays. We can't actually guarantee that 72-hour turnaround time for test results, even in that travel group. So it is unfortunate, it is the state of where we're at right now, and hopefully things will improve sooner rather than later. And we hope that people can be patient while we work through what's happening right now in the situation.
Mr. Fortnum, do you have a follow-up?
I do. Thank you. This one probably best for Minister Shepherd. On the note of the strike, we're hearing about how healthcare impacts could warrant legislation being brought forth sort of to force an end to this strike. Wondering if you have any idea of a metric that you're keeping your eye out for, any what specifically might warrant bringing this legislation forward.
Sure. Thank you for the question. I'm reliant on our experts in the field, our CEOs of Vitalite, Horizon, and EMA&B for that kind of validation. At this time, we're staying steady.
Fortnum, on va passer à Pascal Rochenag avec Radio-Canada.
Oui, bonjour. Ma question est pour
My question is for the Chief Medical Officer of Health. Could you explain to me in French what the situation is in the St. John region and in the Moncton region, and what is pushing you to increase the length of the circuit breaker measures? So there are several things, the number of cases and the transmission that we see. this is not where you want to be. We see transmission in households with people living together, and we also see transmission in the large private gatherings. Do you have a follow-up question? Yes. With the QP strike, there are less tests conducted. How do you make sure that the decisions that are being made are based on reliable data? Like I said earlier, some people are not getting tested, but we have priority groups with a higher risk. And those with the higher risks are those who are getting the PCR tests to make sure that we can rely on all the data that we are using to make decisions on circuit breakers and so on. Thank you very much.
And along with the Miramichi leader.
Good afternoon. You can hear me okay?
Perfectly, thank you.
Thank you, Bruce. My question is for Dr. Russell or Minister Shepherd, whichever one of you can answer this. You talked quite a bit earlier about Zone 7 and how you're keeping an eye on things in that zone. Of course, we've seen a fair number of COVID cases in Zone 7 lately and reports of cases in schools and possible exposure alerts. So I'm wondering if there are any measures beyond the ones currently in place that you're considering for Zone 7, or what might trigger additional measures.
You want to go? Okay. So, yes, so Zone 7 is something that we're very concerned about. And again, we look really closely at the patterns of transmission, the risk areas that we're seeing, and what the potential impacts of that can be. At this moment in time, the regional staff and our team, when we look at this as in terms of all the different factors to consider, they are confident that they can contain the outbreaks currently. And if that's true, and if that's possible, and everybody's working on the same page in that community, then I wouldn't see any more measures or restrictions put in place. However, if things don't stabilize, then yes, we would have to look at a circuit breaker if that is what's necessary. But at this point in time, we're watching really, really closely. We have our hand on the pulse of that situation in terms of all of the communication that we have on a several times a day basis.
Mr. DeLong, do you have a follow-up?
Yes, I do. Thank you. On that note, Dr. Russell, given the number of exposure alerts lately in Zone 7, how concerned are you about the contact tracing situation in Zone 7?
Again, the conversations that our team has had throughout this there's two particular outbreaks that they're looking at. They're confident that they can continue to work on these outbreaks to contain them.
Thank you.
Thank you, Doctor. Thank you, Mr. Shepherd. Thank you, Mr. DeLong. Voilà la fin de notre mise à jour. Merci beaucoup. Update. Thank you very much.